Hello, come on in, take a seat. I heard today you are here for an IUD consultation. I take it you've never had an IUD before? You've just sort of heard about it, but definitely wanted to inquire. Absolutely. Were you thinking you wanted that as far as birth control, or did you want to discuss other options? You wanted that for birth control. All right, no problem. Do you mind if I get your first and last name, please? Right, and then age. And then, have you ever been pregnant before? Gotcha. Do you by any chance know the first day of your last menstrual period? Now, are you someone that gets periods regularly, or are they irregular? So basically, do you ever skip months, or they come pretty scheduled? Okay. Now, when they do come, do they tend to be very painful or debilitating, heavy, long? Do you mind describing them a little bit for me? Now, are you on any medications right now that I should be aware of, or any medical history or medical diagnoses that you've had recently that I again should be aware of? Okay. Any surgeries in the area, whether it involve your uterus, ovaries, tubes? Okay. Do you smoke or drink at all? And are you sexually active currently? Male or female? For a few years, okay. Any history of ever contracting any form of sexually transmitted infection before? Okay. Gotcha. Now, have you been on any other forms of birth control? Okay, and how was your experience with that? Gotcha. All right. Let me just input all of that info into the system here real quick. Now, do you by chance know what type of IUD you would be interested in? Yes, there are actually different types of IUDs, so I'm glad you came in so that we can kind of go over. You said your friend was on the Marina. Yes, Marina is definitely a popular one. Now, the Marina IUD is a hormonal IUD. You didn't even know there were different types. That's okay. Well, that is what I'm here for. So, you wanted the one that your friend had? All right, well, let's just go over a few things just to make sure that after reviewing the risks and the side effects and everything like that, that is still something you're interested in. But yes, we will definitely make note that that is the one you want. All right. If it's okay with you, I would like just to do some vital signs real quick. Yes. Yeah, so the other IUD is the non-hormonal IUD, and that is what is commonly known as the Paragard IUD, or the non-hormonal. So that one works via copper. You're only interested in discussing the hormonal IUDs. All right, absolutely. So we will make that our focus then today. We're going to start with some blood pressure. So let me get the cuff here. You can just stay seated. How is your day going today? Good. So yeah, we'll just make sure you don't have very high blood pressure at all. I am just going to put this around you here. And this one is actually an electric cup. It was normal, so nothing elevated there, which is good. Alright, I'm just going to put that in the system here. Next up is just a temperature check. Alright, this is just going to go underneath your tongue. Very good. Excellent. All right. That temperature check in here. And I am just going to listen to your heart and lungs real quick. Clean off my stethoscope. All right. Okay. Take a deep breath in. Out. Deep breath in. Out. Very good. Very good. All right. So, let us talk about IUDs, shall we? So, I'm just going to kind of get everything set up here for you. And I will have some patient education for you to go home with in case you haven't decided quite when you left, okay? Do you by chance know, by the way, when your last pap smear was? Okay. Any history of abnormal paps? Alright, so IUDs. Now, IUDs are a very great, effective, reversible form of birth control. A lot of people love IUDs because it takes away that human error aspect, meaning that the likelihood of getting pregnant on an IUD is much lower than a form of birth control that you have to control, meaning taking a pill every day or replacing a patch or a ring. So IUDs are great in that regard. They are thought to be about 99% effective, so I will kind of write the facts here for you. Around 99% effective, but of course not 100%. Now, IUDs, as we discussed briefly earlier, can be divided into two categories, hormonal IUDs and non-hormonal IUDs. Now, it sounds like you want a hormonal IUD, which is where the Mirena falls under. Now, with hormonal IUDs, they are progestin only, meaning there's no estrogen. So we don't have to worry about so much the increased risk for blood clots. So you are a candidate for progestin only forms of birth control. Now, the way the IUD or the intrauterine device works is it essentially gets placed inside of your uterus. Now, I don't know if that's something you're familiar with, but to place an IUD, you would be getting a pelvic exam where they would insert a speculum and they actually insert the device through the vaginal area, through the cervical canal, up to sit inside of the uterus. So, let me kind of grab this for you. So you kind of have your general anatomy here. So this would be your cervix, your uterus, and your 2 tubes. The IUD, which looks just like this. It is this T-shaped device. This IUD is going to find its way sitting inside of your uterus. Does this make sense so far? Okay, good. So basically the IUD is going to sit in your uterus, and depending on which hormonal IUD you choose, whether it's the Skyla, Kyleena, Mirena, these tend to vary by dose as well as duration, meaning how long you can keep it in. But if you wanted the Mirena IUD, that could stay in and is effective for birth control up to 8 years. They recently changed that. But if you're using it for bleeding control only, it would only be effective for 5 years. But as a means of contraception, you're actually good to go for 8 years. You like the sound of that? Good. So I know you said you wanted the Mirena, but I just wanted to kind of give you a size comparison regarding the Mirena versus the Kyleena IUD. Now, like I mentioned earlier, the type of hormonal IUD will vary as far as usually the dose and how long it could stay in for, as well as the size of the IUD itself. So this is kind of what the device tools look like that hold the IUDs in. This is what we measure to see how far in you would place the IUD. But let me kind of pull this out here. All right. Do you kind of see? It's sort of hard to tell 100%, but the size difference between the Kyleena, which is green, and the Mirena, which is red. This one is a bit thinner and a bit smaller, and this one is a bit bigger and longer. This has more hormone in it, this one has less. You want to go with the Mirena? Yep, that's okay. Now, a disclaimer I always give people that have had friends that do well in a certain form of birth control is it does not unfortunately necessarily mean you will have the best reaction or best response to it. So it's something we're sort of going to have to identify once it's placed, okay? Now for the hormonal IUD, specifically the Mirena IUD, like I said, it's good to go for 8 years. Now common side effects with progestin-only IUDs sort of involve your bleeding patterns. So for some people, they may stop getting periods altogether, what they call amenorrhea, meaning you don't bleed. Are you okay with that being a possibility? Okay. The other possible side effect that you may experience regarding bleeding with the Mirena is you may still get regular periods, but they may be a lot lighter, and if you typically get pain, they should be less painful. Does that sound okay for you? Most people aren't mad about that. And this is also just to consent that you understand that you may experience breakthrough or irregular bleeding while having the Mirena IUD, meaning that there are people that can have irregular bleeding or they may spot for weeks sometimes, and that is just something that you have to consent into understanding that that is a possible side effect as well. You understand? All right. Now, being that it is a hormonal IUD, you may experience side effects, especially the first 3 to 6 months because of that hormone. Some of the side effects unrelated to bleeding could be headaches, moodiness, acne, or even weight changes or some weight gain. Do you understand and consent to that? Yes, I can make sure to put that in your copy here for you to take home. I'll definitely give you patient education if you're unsure if you want it 100%. All right. We are also going to provide you with a pamphlet regarding pain management options as far as IUD insertions as well as removals. Also, depending on your personal history with in-office procedures, if you're someone that's a bit more prone to pre-procedural anxiety, we will accommodate that. Do you have any questions so far? Okay. Now, other things that you are consenting to as far as the procedure is concerned is you understand that 1 in every 1,000 cases there's something called IUD perforation that could happen, meaning that the IUD was to go through the uterus and would have to get surgically removed. Another possible risk to the IUD insertion is what they call self-expulsion, meaning your body may actually reject the IUD and push it out. Yes, exactly. So, as part of the waiver here, you consent to both of those things as far as understanding risks. Yep, exactly. What I am going to need from you today, if you wouldn't mind, is I do just want to get a urine sample if we decide to put in the IUD today. And I'm also going to be collecting some of that urine today, just so you know, for your knowledge, to run an STI screen, just so we know for sure that you have no infection at time of insertion. That makes sense? Awesome. Let me put all of that in. So, with that being said, do you have any questions regarding the hormonal IUD? Is there anything that is concerning you at all? You want to definitely think about it more? Absolutely, absolutely. What I'll do is I'm going to let you leave home with this informative kit. It also explains how we insert the IUD, and so I'll let you leave home with that, as well as this little uterine example device for you to just look at and keep. In the event that you change your mind and you want the non-hormonal IUD, you can always come back in and we can definitely talk about that. Absolutely, absolutely. So how about you think about it, and then I'll just put in the notes here that if it's something you're interested in, you've already been counseled, and we can get your insertion set up. Absolutely. And I made sure that pamphlet I gave you also has a list of side effects just for you to review again. Absolutely. No, it is my pleasure. I hope you have a very good day, and you keep me posted if you would like your Mirena IUD.